Basics of Medical Biochemistry. First edition, 2024. Chapter 20. Diet and Nutrition, Part 3 of 3. By Professor Dr. Muhammad Jawad. MBBS, Dao, M. Philosophy, Ph.D., Dip M.E. Head of the Biochemistry Department-Fazaia Ruth Pfau Medical College, Air University-PAF Base Faisal-Karachi-Pakistan. Ex-Professor of Biochemistry, Qassim University Kingdom of Saudi Arabia. Ex-Professor, Head of the Biochemistry Department and Vice Principal. Liaquat College of Medicine and Dentistry and Fatima Jinnah Dental College, Karachi, Pakistan. 20.9 Malnutrition. Malnutrition is a state produced by an insufficient calorie intake causing undernutrition. It is insufficient intake of one or more of the essential nutrients, especially proteins, causing various deficiency symptoms. These are considered as primary causes of malnutrition, example marasmus and kwashiorkor respectively. Secondary causes of malnutrition are due to inadequate absorption or utilization of nutrients, as in malabsorption syndrome, or due to an increase in their requirements, destruction, or excretion, generally secondary to disease with special features superadded by the pre-existing disease. Thus, nutrition plays a great role in the body to keep it healthy and face the daily requirements of the body by giving the energy to do all work with full enthusiasm. As every cell of every tissue and organ in the body has been made from and is maintained in a healthy state by the food which is eaten. 20.9.1 Protein Energy Malnutrition, PEM, or Protein Caloric Malnutrition, PCM. This refers to severe undernutrition in an infant or young child. It is a childhood version of starvation. It usually occurs during 6 to 12 months of age. The main cause is a diet very low in energy, protein, and other essential nutrients. Typically, it is a disease of infants of poor parents living in the cities of developing countries. The child is weaned early, and the parents have difficulty in providing good quality food due to poverty. Moreover, there is no access to clean water. The combination of malnutrition and poor hygiene predisposes to gastroenteritis with diarrhea and poor appetite, which further depletes the child's energy reserve. The child is very thin, with no subcutaneous fat. Muscles are severely wasted. The head is large for the body and the ribs stand out. The abdomen shows gaseous distension and diarrhea is usual. Body weight is reduced to 60% of the WHO standard. Chronic infections may be there. Dehydration frequently occurs from diarrhea or vomiting. Primary PEM is due to an inadequate intake of protein and calories, seen in famines, war, and severe poverty. Secondary PEM is due to an illness that causes impaired intake or utilization of nutrients. It is seen in malignancy, malabsorption, HIV infection, chronic renal failure, etc. 20.9.2 Marasmus. It is a form of malnutrition. It happens when the intake of nutrients and energy is too low for the body's needs. It leads to waste or the loss of body fat and muscle. A child with marasmus may not grow as children usually do. It usually affects infants under 1 year of age. Premature babies with local disease and or malformed mouth or nose are mostly involved. It occurs in children that don't ingest enough protein, calories, carbohydrates and other important nutrients. This is usually due to poverty and a scarcity of food. The main clinical features are: the child is underweight and has lost a lot of muscle mass and subcutaneous fat. Chronic and remittent diarrhea. Dizziness, fatigue, and marked bony prominence due to rapid weight loss. Dehydration and electrolyte imbalance. Dry skin and brittle hair. Anemia with low hemoglobin and hematocrit. Subnormal BMR. 20.9.3 Kwashiorkor. This type of malnutrition occurs most often in the second year of life in a child weaned from the breast onto a starchy diet very low in protein, such as cassava, yam plantain, sweet potato, or cereal that has been refined and diluted. Low milk and limited food to children. Such a child may appear in moderate health until its protein requirements are increased by an infection. Gastroenteritis, measles, or malaria are notorious precipitations of kwashiorkor. Pathogenesis of kwashiorkor includes the following events. Low dietary protein but adequate carbohydrates. Insulin secretion is maintained. Insulin-sparse muscle protein at the expense of liver protein. Fall in serum albumin. Edema may mask the actual status of wasting. Transport of free fatty acids from adipose tissues to the liver results in fatty liver. The main clinical features of kwashiorkor are: clinically, the child is not thin but miserable and apathetic. Generalized edema. Characteristic mewing cry. Symmetrical skin changes maximally around the napkin area. These areas are at first pigmented and then thickened as varnished cracks with denuded areas of shallow ulceration. Dermatoses resembling crazy paving in moderate cases. In severe cases, desquamated areas looked like burnt patches. The hair alters color from black to blonde, reddish, or gray and becomes thin and sparse. Angular stomatitis. Anorexia and diarrhea. Figure 20.3 marasmus, source, slideplayer.com. Figure 20.4 kwashiorkor, source, slideplayer.com. 20.9.4 Marasmic kwashiorkor. Symptoms of both marasmus and kwashiorkor are sometimes produced in a mixed way depending on the relative degrees of protein and calorie deficiencies. Deficiencies of vitamins and minerals may also be found in these diseases. Example: hypoprothrombonemia, vitamin K deficiency, pellagra, niacin deficiency, and anemia. The main difference between marasmus and kwashiorkor is, marasmus predominantly occurs before the first year of age, whereas kwashiorkor occurrence increases after 18 months. It can be distinguished from marasmus in that kwashiorkor is a protein deficiency with adequate energy intake, whereas marasmus is inadequate energy intake in all forms, including protein. In contrast to kwashiorkor, there is no edema in the marasmus and skin and hair changes are mild or absent. The child is not usually anorexic. Marasmus is more common than kwashiorkor. The prognosis of marasmus is comparatively good with adequate dietary treatment. 20.10 Eating disorders. These are irregular and chaotic eating patterns such as fasting, binging, dieting, skipping meals, undereating or overeating. Individuals with eating disorders feel bad, fatigue, vague discomfort and lack of concentration after eating. 20.10.1 Anorexia nervosa. It is an eating disorder characterized by an abnormally low body weight, an intense fear of gaining weight and an inaccurate opinion of weight. Most symptoms of anorexia nervosa are the result of self-starvation. Chief clinical features of anorexia nervosa include constipation, faintness, abdominal pains, bloating, muscle weakness, poor circulation resulting in feeling constantly cold, dry, and yellow-colored skin. Anorexic people may control calorie intake by vomiting after eating or by misusing laxatives, diet aids, diuretics, or enemas. The disorder is diagnosed when a person weighs at least 15% less than their normal/ideal body weight. The outcome of this eating disorder is quite serious. The disease has the highest mortality rate of all mental health disorders. As many as 20% of the people who suffer from anorexia will eventually die from it, and as long as they remain in this disease they have a greater risk of death. 20.10.2 Bulimia nervosa. It is a serious eating disorder in which first one eats large amounts of food and then purges to get rid of extra calories. It is characterized by uncontrolled episodes of overeating, called binging. This is followed by purging with methods such as vomiting or misuse of laxatives. Binging is eating much larger amounts of food than one would normally eat in a short period, usually less than 2 hours. Bulimia affects more girls and younger women than older women. Patients with bulimia nervosa can show significant symptoms of malnutrition. Main symptoms include Russell's sign, scars on the back of the knuckles and hands due to repeated contact of the fingers with teeth during self-induced vomiting, tooth decay, swollen salivary glands, acid reflux, sore throat and hoarse voice, dehydration, electrolyte disturbances and various intestinal problems. 20.10.3 Binge eating disorder. It is similar to bulimia nervosa but purging behaviors are absent. It is one of the most prevalent eating disorders among adults. It is associated with negative psychological and social problems like embarrassment, shame, guilt, anxiety, and depression. 20.10.4 Metabolic consequences of eating disorders. Suppressed metabolism and reduced basal metabolic rate. Increased catabolism and breakdown of muscle, brain, and bone tissue. Weight loss, 70% is lean tissue and 30% is fat. Decreased anabolism. Electrolyte abnormalities regarding potassium, sodium and phosphorus. Hypercholesterolemia early and hypocholesterolemia late. Hypoglycemic coma can occur in very low weight patients, especially after prolonged fasting or recent exercise. Iron, calcium, and vitamin D deficiencies. 20.10.5 Endocrine system consequences of eating disorders. Amenorrhea, lack of menstrual periods, low FSH, LH levels, the prepubertal pattern of LH secretion, blunted LH, FSH response to LHRH bolus, and repeated LHRH boluses can induce ovulation. Estrogen deficiency, no withdrawal bleeding after progestin challenge, atrophic changes in the vagina and external genitalia. Sick thyroid syndrome, the result is a reduced metabolic rate accounting for the hypothyroid-like presentation of bradycardia, cold intolerance, constipation, dry skin, and diminished reflexes. Elevated cortisol levels. 20.10.6 Bone consequences of eating disorders. Osteoporosis. Lack of normal bone density gains in adolescence and early adulthood. Midlife osteoporosis if peak bone density is low. Suppressed bone formation is related to hormonal changes that affect calcium uptake into bone. Stress fractures. Figure 20.5 Normal bone density growth. 20.10.7 Gastrointestinal consequences of eating disorders. Delayed gastric emptying contributes to postprandial discomfort and a feeling of fullness. Reduced intestinal motility contributes to bloating and constipation. Gastroesophageal reflux and gastric tears and dental erosions secondary to self-induced vomiting. Elevated liver enzymes secondary to malnutrition. 20.10.8 Cardiovascular consequences of eating disorders. Reduced heart size. Cardiac arrhythmias. 20.10.9 Hematologic consequences of eating disorders. Bone marrow depression. Anemia, leukopenia, and thrombocytopenia. 20.11 Role of dietitian and nutritionist. Dietitians deal with healthy and sick people while nutritionists are limited to healthy individuals only. Dietitians are trained professionals who promote nutritional well-being and treat medical conditions through medical nutrition therapy. A nutritionist is a person who advises others on matters of food and nutrition and their impacts on health. The following are the important tasks of a nutritionist. Educate individuals and families about normal and abnormal food intake patterns, hunger patterns, and somatic sensations resulting from these. Assist the individual in understanding the connection between emotions and behaviors, enabling him or her to nourish the body and deal with emotions separately. Guide the individual or family in developing a healthy relationship with food to normalize eating patterns and maintain a healthy/stable weight range. Figure 20.6 Growth chart, height and weight for age. Figure 20.7 Growth chart, body mass index for age. Summary. Food is any substance consumed to provide nutritional support to the body.
Diet varies with age, sex, profession, and various physiological and other special conditions.
Higher organisms use the chemical energy in fuels, carbohydrates, lipids, to bring about the synthesis of complex macromolecules from simple precursors. The energy supplied by diet can be measured in joules or calories. Energy balance means taking in, i.e., eating and expenditure through work, exercise, etc., an equal number of calories or kilocalories. Males between 15 and 18 need about 2,750 calories per day and females between 15 and 18 need about 2,100 calories per day.
A healthy diet helps maintain or improve overall health.
A diet high in fats and low in carbohydrates is known as the ketogenic diet.
Men having more than 19% of their total body composition as fat and women having more than 26% of their total body composition as fat are known as an overfat individuals. The use of foods by an organism is termed nutrition.
Nutrients are the chemical substances present in food that provide energy, provide materials for building body parts, provide factors to regulate needed chemical processes in the body and function as an antioxidant. Carbohydrates are the chief constituent of our diet and act as an instant source of energy for the body. Their caloric value is 4.1 kcal/g. Proteins are required for the repair and growth of the body, thus involved in building body tissues by providing amino acids. RDA for protein is 56 g/day for a 70 kg man. The biological value, BV, of protein is a measure of the proportion of absorbed protein from food that becomes incorporated into the proteins of the body. The chemical score of protein is a measure of protein quality based on chemical analysis of its amino acid composition. Lipids provide energy and help in storing energy and vitamins. Found in cheese, cream, butter, margarine, meat, nuts, and oils. Vitamins help in getting energy from carbohydrates, proteins, and lipids. Most vitamins cannot be produced by the body, so must be present in the diet. Minerals are concerned with the regulation of water balance, bone development, and maintenance. A diet that can be followed for a long period and keep the body healthy is called a balanced diet. A person must have all the components of a diet, otherwise there will be tiredness due to the shortage of energy. RDA is the dietary intake that is sufficient to meet the daily nutrient requirements of 98% of the individuals in a specific life stage group and with specific physiological conditions, such as pregnancy and lactation. Milk contains casein, lactalbumin, and lactoglobulin. All three proteins are of a high biological value, containing all essential amino acids. Pasteurization of milk is the process of heating milk to 72 degrees Celsius for at least 15 seconds, and no more than 25 seconds, then cooled very quickly and kept cooled until delivered. An egg of average size gives 162 calories per 100 g in the body. Vegetables contain cellulose, which increases stool mass, eases passage, and reduces transit time. Women who have a healthy diet during pregnancy are more likely to have a baby that has grown and developed properly. Folate has considerable significance during pregnancy. It prevents certain birth defects of the brain and spinal cord during the first months of pregnancy. Pregnant women need about 600 mg of folate each day. The ratio of the quantity of carbon dioxide produced to the quantity of oxygen consumed per unit of time is known as the respiratory quotient. Basal metabolic rate, BMR, is the minimum amount of energy required by the body to maintain life at complete physical and mental rest in a post-absorptive state. The standard value of BMR for an adult man is 35 to 38 kcal/m2/hour and for an adult woman is 32 to 35 kcal/m2/hour. Malnutrition is a state produced by an insufficient calorie intake causing undernutrition. Marasmus is a form of malnutrition. It happens when the intake of nutrients and energy is too low for the body's needs. Kwashiorkor is a type of malnutrition that occurs most often in the second year of life in a child weaned from the breast onto a starchy diet very low in protein such as cassava, yam plantain, sweet potato, or a bowl of cereal that has been refined and diluted. Anorexia nervosa is an eating disorder characterized by abnormally low body weight, an intense fear of gaining weight and an inaccurate opinion of weight. Bulimia nervosa is a serious eating disorder in which first one eats large amounts of food and then purges to get rid of extra calories. References. Exercise questions. MCQ 1. Which of the following metabolic reactions occurs after the digestion of a high carbohydrate meal? Glucagon is released from the pancreas. Insulin stimulates the transport of glucose into the nervous tissue of the brain. Utilization of glucose as the major fuel by the liver and skeleton muscle. Red blood cells oxidize glucose to CO2. Skeleton muscles convert glucose to fatty acids. MCQ 2. A 43-year-old man presented with elevated levels of chylomicron and total cholesterol. Which of the following dietary therapy would be most helpful to lower chylomicron and total cholesterol levels in this patient? A. Decreased intake of calories. A. Decreased intake of cholesterol. A. Decreased intake of fat. A. Decreased intake of starch. A. Decreased intake of sugar. MCQ 3. An overweight 19-year-old boy discovered that he could not exercise enough during his summer training camp to lose 2 to 3 pounds per week. He decided to lose weight by eating only 300 kilocalories per day of a dietary supplement that provided half the calories as carbohydrates and half as protein. Which of the following metabolic events happened during the first 3 days of this diet? Both his adipose mass and muscle mass decreased. He developed severe hypoglycemia. He remained in the nitrogen balance. His carbohydrate intake met the fuel needs of his brain. His protein intake met the RDA for protein. MCQ 4. An 8-year-old boy presented in an OPD with signs of edema on limbs, blonde sparse hair and dermatoses. His weight was 70% of the standard for his age. Which of the following is the most likely condition in this patient? Iron deficiency, kwashiorkor, marasmus, mineral deficiency, vitamin A deficiency. MCQ 5. A mother brought her 20-month-old son to the pediatric clinic to complain of growth failure. The child was weaned 1 year ago because she got pregnant. After weaning, her son became irritable and restless and had repeated attacks of fever associated with diarrhea. This poor family has 6 children and mostly ate potatoes. Which one of the following nutrients is richly found in the food of the patient that he ate mostly? Albumin, casein, cholesterol, glycogen, starch. End of Part 3 of 3 of Chapter 20. Thank you.